My name is Gianluca Ingrosso. I am a radiation oncologist and I work at University of Perugia. I'm an associate professor there and I'm involved in GU cancer. I talked about the role of biomarkers in active surveillance. Active surveillance is a treatment option for low-risk patients and for intermediate risk. And it is an important treatment option because we are able to follow patients during time without giving active treatment, which may decrease their quality of life. And we are able to offer an active treatment and deferred active treatment at the right time for these patients. And biomarkers are very important because they can guide us toward this treatment. Okay. And new biomarkers are coming, so it's a very interesting field of research, and there will be new insights in clinical practice. Biomarkers are very exciting because I think they will do a kind of revolution in the way we stratify patients. So now, basically, we stratify patients based on the D'Amico classification, and we have mainly three class risk, which are low, intermediate, and high. Whereas with new biomarkers, maybe we will be able to better stratify this patient and add the clinical parameters to the new biomarkers and better select which kind of treatment we could offer, and also at what time, and also how intensify or de-intensify our active surveillance. Yes, I think that biomarkers could work also on that, and that is because, as I said before, they will change the way we stratify patients, so maybe we will be able to better stratify intermediate risk, and so offer a more tailored treatment option for these patients. The role of MRI is very crucial during active surveillance as well. So there is the need to have target biopsy and systematic biopsy combined, and the use of tissue biomarkers is very interesting. To date, we have many data on the whole specimen, on the whole process, so it's not so easy to think about their use in biopsy-based specimen, but it might be a field of research and clinical research. And so I think that these two biomarkers that give a genetic profile of the tumor tissue are very interesting for the opportunity to better know the features of the tumor, because now we have only morphological tumors, and for instance, we know that about 2% of Gleason 6 patients have aggressive genotype. So it is very interesting to have this data in order to better know the prognosis of this disease. Yes, it's true. In Europe, we use mainly PSA, we use PSA density, and we combine with MRI. And there are new tests, such as the diagnostic test, the Stockholm 3 test, So something is happening also in Europe. But I think that we need prospective trial because we need to validate these biomarkers in the decision-making process to allow them their use in the clinical practice. So maybe this is what we are waiting for. And I hope in the next years we will have, I mean, we have a PSA derivatives like prostatitis index and Folt-Carlicrane, which have been tested also in Europe. In Europe, the Folt-Carlicrane has been tested in the PROTECT trial. And I think that these PSA derivatives will come soon.